This is a 24-year-old African-American female who presented to our emergency room acutely short of breath. She is 12 weeks pregnant. A CT scan was performed that demonstrated significant clot in her right main pulmonary artery as well as in the upper and lower lobe branches. In addition, there is extensive clot in the left lower lobe pulmonary artery. There are multiple treatment options. Traditionally, this patient would be treated with heparin and Coumadin. She could also be given systemic thrombolytics, catheter-directed thrombolytics, have an extraction catheter placed and the clot removed, or she could have a surgical embolectomy. At our institution, extraction catheters are not available and surgery was not an option. The pulmonary physician who requested that I see this patient is a big fan of systemic thrombolytics for these patients. However, he was concerned about the high intracranial hemorrhage rate ranging up to 10%, particularly when this woman is pregnant. The patient was brought to the interventional radiology suite and her pulmonary artery pressure was taken. It was 70/40 with a mean of 55. This is severe pulmonary artery hypertension. In addition, she previously had a cardiac echo that showed severe strain in the right ventricle. The pulmonary arteriogram showed abrupt cutoff of the right pulmonary artery with no flow into the right pulmonary artery with reflux into the left pulmonary artery. In addition, a left pulmonary arteriogram was obtained that showed clot in the main left pulmonary artery and cutoffs into the left lower lobe pulmonary artery. 2 catheters were placed, as you can see here. The catheters were left in place and TPA was begun at the rate of 0.45 milligrams per hour per catheter. I place 10 milligrams of TPA in 250 cc's of normal saline and run them at 10 cc's an hour. I do not attempt to fragment the clot and I do not give them a bolus of TPA. The patient was taken to the intensive care unit and brought down approximately 24 hours later, and as you can see, the right pulmonary artery is markedly improved with still some residual clot. However, her pressures have returned to essentially normal, now 35/15 with a mean of 25. The left pulmonary artery is also significantly improved with a small amount of clot remaining in the left lower lobe. Please remember that there was no flow in the right pulmonary artery at all and no flow to the left lower lobe. If there are any further questions, please do not hesitate to contact me at tpmmd@hotmail.com. Thank you for your attention.